If you've seen the movie Inside Out or spent even 5 minutes on Instagram, you've probably encountered the term core memory. The idea of the movie is that there are certain core memories that trigger permanent or semi permanent foundational pillars of our personalities. Some of today's guests' core memories became the foundational pillars of her entire career.
My mom, after seeing the immense struggle that people have with dialysis, she just said, I really want you to be someone who helps to prevent kidney failure.
That's professor, nephrologist, researcher, and National Kidney Foundation board member, Dr. Holly Maddox Kramer. I'm Sarah Jane Castro, Senior Director of Marketing and Communications for the National Kidney Foundation of Illinois, and your host for this edition of The Journey Continues. Dr. Kramer, thank you for coming on The Journey Continues. Can you tell us how your mother influenced your career path?
May I just say, Sarah, that was super awesome. Like your introduction there. I'm like,
Thank
wow,
you.
yeah, what are the foundations of people's lives? Yeah. And, and I was thinking, what has been the imprint of my life? And definitely my mother. That's so funny, this introduction. So my mom was a home dialysis nurse. She was originally actually a psych nurse. So this was in the 1970s, and they had such high mortality rate with dialysis and people who were struggling with kidney failure. And they needed to have someone be able to counsel patients and families because of the really high mortality rate in dialysis. Then as the number of patients receiving dialysis grew, they really needed to train people to become home dialysis nurses. And so she transitioned to home dialysis, but at the same time, she still was counseling patients and families. I remember when I was young, she would take me out of school and we would go visit patients' houses. And I just remember the imprint on my mind is blue carpet. Everyone had blue shag carpet back then in the early 1980s. And then you'd see this gigantic dialysis machine sitting on the shag carpet. And some people would have like fountains, like little water fountains in their home to decorate. I remember that's a big thing too. I didn't really have much of a choice of what I was going to do with my life because my mom, after seeing the immense struggle that people have with dialysis back then, she just said, I really want you to be someone who helps to prevent kidney failure. And I feel like after 20 years of struggling with that concept, I'm finally there. I feel like because of the work of the National Kidney Foundation and all of its affiliates, including National Kidney Foundation of Illinois, that we really do have so much more hope for patients now. And there is just such immense possibility for keeping people off dialysis. But we still have huge changes that we need to make to really get to where I hope that we are, and my mom would have hoped that we are as well. So, yeah, I think everyone who's a nephrologist has some story, like some kind of imprinting of what led you there. And I think like your introduction can really help people kind of like think back in their memory and like, why in the heck am I in this crazy profession, right? Or if you're someone who's an advocate or you're working with the National Kidney Foundation or one of its affiliates, like what was the reason that drew you to this crazy place, right? But I feel like it's such a great place to be because there's such a huge need. Every day that you go to work, you're helping someone, you're doing something, you're moving the needle in some aspect, right? Whereas like in other specialties and other aspects of care, or if you're working with other foundations, I'm just not sure that you feel that incremental change. I mean, I look back what has been like over the past 10 years, like huge changes in the diagnosis and clinical care and awareness of kidney disease.
Absolutely. And I've heard other providers say that too, that they like working in kidney care because you can see your patients improve, whether that's from pre-dialysis, improving their nutrition and, improving their numbers, or post-transplant. It's a field where you can kind of follow your patients and see them feel better, which has got to feel good as a physician. Do you think you would have pursued the career in nephrology if you hadn't gone alongside your mom to patients' homes?
I really wanted to be a writer. I wanted to be like, write novels and be on television shows where they say like, why did you write this novel? And that's what I wanted to do. My dad wanted to be a journalist, but yeah, I had a different calling. And sometimes I really cursed my mom, like, why the heck, she asked me to do this, because sometimes it can be so sad, so difficult, so challenging. But no, I feel super blessed. I feel, that I'm in the right place.
You are obviously very talented at what you do and very invested. So I think you probably made the right choice. And there's still time. You can write those novels if you want.
I would read them. Yeah.
I'm sure you have plenty to write about too at this point in your career. So, once you completed medical school, you decided to pursue a master's in public health. Why did you decide to go that route?
So I actually got a grant from the American Kidney Fund, the American Kidney Fund Clinical Scientist in Nephrology Award, which is really a fantastic award that allows you to not only do research and provide support so that you could do research, but it allowed me to get formal training in epidemiology. So this was during my nephrology fellowship. I will say that I recommend that all nephrologists, actually all physicians, take a formal course in epidemiology. I thought that was like my eye-opening moment when I started to learn about the distribution of disease and why does the disease, like kidney disease, distribute differently compared to like cardiovascular disease or cancer? Why is it that we see dialysis units in certain areas of the country, certain areas of Chicago, not in certain suburbs, but more in inner cities, right?
Mm.
Like, why is that? So it's like, instead of like looking at a patient and saying, why did this patient get this? You're going several steps back and kind of like looking at the forest, like, why is certain parts of the forest on fire while other parts of the forest are not? Why do the flowers grow in this part of the forest, but they don't in the other, right? So it's really taking a far back look at what is going on with disease. And I thought that was so incredibly important, not just for research, but to really understand, even at the individual level, why does this individual have kidney disease? So then you can really understand why not having access to healthy foods, not having a safe place to go for a walk, can really influence the development of disease over time, right?
Right. Yeah.
So that's why I really think like taking a formal course in epidemiology, and not just like, a lecture, but a whole course, would really help all physicians be better clinicians, in my opinion.
You mentioned your mom underlining the importance of prevention. Why is prevention so important to you?
Prevention is really important because for kidney disease, we're talking about 157 billion dollars annually that's spent on a disease that only affects, less than a million people. I mean, it's a no-brainer that if we prevent kidney disease, we could really help to reduce costs for Medicare. I mean, right now, I just saw that there's a committee, talking about trying to cut back on Medicare spending, and I don't blame them. Like, right? It's like every year we're increasing the amount in the billions that we spend on kidney failure, by like about 10 billion each year. Right. So like prevention is so important for the health of our healthcare system, but also like at the individual level, kidney disease, not only is it an issue of kidney failure, which really is a rare event, but it accelerates cardiovascular disease, right? It makes management of pain and rheumatoid arthritis or osteoarthritis more difficult, right? It's going to make fighting cancer more difficult. It it really robs people sometimes of their ability to have full cognition. It gives people mental health issues and anxiety, right? So it's really like a quality of life issue. And then the other issue is that there's huge health disparities. So if you prevent kidney disease, you're going to be able to really help improve health disparities, which like if you look at the CDC, there's like a really great podcast on the CDC website about health disparities and basically saying like, we have not moved the needle at all with regards to health disparities. And I think one of the big reasons is because there hasn't been enough emphasis on kidney disease, which has the widest health disparities out of almost all chronic health conditions, right? We're not talking about it. Even that podcast didn't talk about it. That I think is the biggest issue. So it's because it can really if we prevent kidney disease, we're going to improve health disparities. We're going to decrease that gap between race, ethnicity, between poor and not poor, between educated and poorly educated, right? All of those gaps we would help to really decrease. Reduce healthcare spending, make both the blue and the red sides of the political spectrum happy,
Mm-hmm.
and improve the health of our healthcare system. But I don't understand why we can't, like, we're so excited about preventing kidney disease. Why can't we make everybody else just as excited as us? I'm not sure about that. That's a really good question.
Yeah, it seems like it would be much simpler in the long run to prevent rather than to have all these sort of back end try to fix it later once, like you said, the cardiovascular disease and you've got your brain cognition, all of those things start to come into place. It's a lot harder to try to backtrack and control versus preventing in the first place. So
Right.
let's talk some about those health disparities. What does that look like practically, and how do we help people bridge those gaps?
I think the big issue has to do with awareness because kidney disease lacks symptoms, right? Most of the time, people are completely unaware that they have kidney disease. So you really need to get people who are at higher risk to reach out to their doctors and ask about testing. And the way that we've done that in the past with diseases that lack symptoms like hypertension, which they call the silent killer, or high cholesterol, which remains, major factor for developing cardiovascular disease, was that Congress, the NIH, CDC all came together with funding, a lot of funding. We're talking hundreds of millions of dollars of funding to educate communities, to develop screening programs, to educate clinicians, educate patients, community service announcements. Do you know your cholesterol? Do you know your blood pressure? And getting people to assess blood pressure routinely, even like at the dentist, they're assessing your blood
Mm-hmm.
pressure, right? People know their cholesterol. People ask doctors, can you please check my cholesterol? What is my cholesterol, right? We need that same mode of thinking for kidney disease. And that takes a community, not just, people who are kidney advocates, but that takes Congress to invest in it. So right now they're only investing like less than $10 million annually to fund CDC prevention on kidney disease. And so, we don't have billboards saying, hey, do you know your GFR? We don't have, CDC funded commercials saying, do you know your urine album to creatinine ratios? If you have diabetes, are you getting screened? Right? We don't have that. Yet, in the 1970s and 80s, they invested hundreds of millions of dollars to help improve cholesterol education programs and to improve knowledge about hypertension. And that's what we need.
How do we get there? I don't know if you have the answer to that, but how do we get people to care and push kidney health to the forefront?
I think that we are moving the needle in the fact that we're getting more and more people who have lived experience with kidney disease, they're caretakers, to go to Congress and talk. They have to tell their story. So if you are a patient with kidney disease and you're like, I cannot tell my story one more time, I'm telling you, you need to tell your story not one more time, but like 100 more times.
Mm-hmm.
So we need that story of, hey, I was diagnosed late. The labs were there. No one told me that I had kidney disease. That story needs to be told over and over and over. So it's all about just being there in Washington, D.C., and being a squeaky wheel. So I can tell you, like in the 80s, 90s, and early 2000, the people who were in Congress, they weren't talking about kidney disease prevention. They might have been talking about dialysis access, but there wasn't
Mm-hmm.
any talk about kidney disease prevention, early testing. And one of the reasons is because we really didn't have anything that we could do if we diagnosed you, right? We really lacked therapies, but that's not true at all anymore. And so it's like a miracle now. I mean, I'm just amazed. I combined some of these medications and I can keep really high risk patients off dialysis.
That's incredible.
You just have to get diagnosed.
Mm-hmm. Right. We unfortunately hear that story so frequently that the labs were there, but it could be explained away by something else. Or maybe nobody had a conversation with me about taking my kidney health seriously. So I think you're absolutely right. Keep sharing that story, keep talking about it so that we can move that needle even a little further.
And the other thing I would say is that I think a lot of people are just really scared. Like I see some people where the doctors, their primary care doctor knows that they have kidney disease and they're encouraging them to see a nephrologist, but they're scared.
Mm.
They don't want to see a nephrologist. But I'm telling you, we can do something to help you. It's not like how it was like where you have kidney disease and it's inevitable that you're going to go on dialysis. If you know that you have kidney disease, see a nephrologist. If you have stage 3B, 4 chronic kidney disease, see a nephrologist. Ask about medications that can help prevent kidney disease. They're advertised on television. They may be able to help you. I think like fear can a lot of times be your worst enemy. So seek care.
What factor does nutrition play into preventing chronic kidney disease?
Nutrition is hugely important for your kidney health because your kidneys actually have to take the proteins that you eat and metabolize them into amino acids and then put them away, right? Store them away. Get rid of the ones you don't need, reabsorb the ones you need, right? Put them away. So it's just like, I kind of think about this like if you're eating a ton of unhealthy foods, processed foods, it's kind of like my teenage daughter's room. So she has way too many clothes and then she doesn't put her clothes away. They're all over the place, right? It's kind of like what it would be like if you're eating a lot of unhealthy foods and what it would look like in your kidney, right? It's just like a lot of things aren't put away. Your kidney feels overwhelmed with all the work that it has to do. It's overworked. So eating healthy foods and not eating too much red meat is my thing. I think processed meat is not good. So, for example, if your kidney function is low, there are some of these metabolites that are produced when you metabolize red meat. And so if you have decreased kidney function, glomerular filtration rate, then it doesn't get excreted the way it would if you had normal kidney function and then accumulates in your body and can accelerate cardiovascular disease. So that's why, eating a lot of processed red meats in the setting of reduced kidney function can be bad. And then if you eat a lot of processed foods, especially if you eat a lot of sugar, then that's going to increase your insulin production, can lead to insulin resistance. And then all that excess sugar can actually kind of create like a gum in your kidney on the basement membranes. It deposits on the basement membranes of your vessels, including in your kidney, and that's not good either. So I just always encourage my patients to eat healthy foods. I'm an American, so I like to think what you need more of instead of what you need less of, right? So eat more healthy foods. But I do try to get people, because I work in Chicago, to not eat hot dogs. So I say if you're at a Cubs game or White Sox game, you're allowed to eat a hot dog. But otherwise, can't eat a hot dog. Now, the other thing, my soapbox is that we have registered dietitians who can give you a lot better advice than what I can. So, I don't have the knowledge and the experience of a registered dietitian. So I really encourage my patients to talk with a registered dietitian. So most people probably don't know is that Medicare and most private insurance will provide you medical nutrition therapy. So that means you can meet at least 3 hours for the first year and 2 hours the second and third year with a registered dietitian. And that registered dietitian will take a history from you to figure out like what is you like to eat, what is your dietary pattern, and then help you modify your dietary pattern to improve your health and modify your diet to help prevent disease progression. And it's free. So it's with no cost sharing by Medicare and by almost all private insurers. Medicaid might be a little bit different story. The other thing is that the National Kidney Foundation does have like a list of dietitians. So like if you live in a rural area, you can do like a telehealth visit with a dietitian, even if that dietitian isn't in your state.
Let's talk a little bit about your research. What are you passionate about studying?
I'm really passionate about looking at factors that can be modified. So I have done genetic research, but I think what's really interesting is to look at factors that we know you can modify. So like obesity, for example, we now know that if you lose weight, regardless of how you lose weight, I mean, if you lose weight with drugs or you lose weight with exercise and diet, doesn't really matter. it benefits your kidneys, period. And it will benefit regardless of the type of a kidney disease you have. So even if you have genetic disease, like you have polycystic kidney disease, we know that weight loss benefits those individuals as well. It slows kidney disease progression, slows the growth of the kidneys overall. I think, trying to get people to just have a healthier lifestyle, to me, is really important. And however we can do that, whether it's like talking with a dietitian or getting people to try to eat better, that's what I'm really passionate about.
You're also a professor. What do you teach?
I teach public health. So I actually started the MPH program at Loyola. And when we first started our first class, I think we had 6 students. And one of the graduates actually has been working at the VA since she graduated. So she works in the clinical trials unit. So hi, Michelle, in case you're listening. So now we have like over 100 students now and graduated quite a few people. Loyola is all about mission of social justice and health. And so that's what we try to do. So right now I teach a class that is utilizing the issue of homelessness as a way to learn about public data. So I teach people how to utilize like the BRFSS data, the area deprivation index, and different publicly available data sets to analyze public health issues, but they learn about it through the lens of homelessness. So we actually have people who have lived experience of homelessness talk to the students, and
Wow.
it's really interesting. And actually, there are people who started a foundation for helping people who are on dialysis who are homeless, because that's actually a big problem. And so I've learned so much about other people who have done so much to address the issue of homelessness. So that's what I teach right now.
What do you hope to instill in your students beyond the facts and the data?
My big thing is trying to get people to see that they can make a difference. I mean, I think that like some of the biggest issues that people have fought for is really one person that drove that. I mean, yeah, one person that's obviously they bring in other people to help, but generally it's always one person is the person who kind of started it, right? And then you get people to mimic you and they will also go out and do the same thing, and then you grow a stronger and stronger string, right? So kind of like the spider web. So I really try to get people to see that, yes, you can make a difference. Don't ever think that what I do doesn't matter. You're absolutely wrong. And I always tell all my friends who are in nephrology, you've made more of a difference than you know. Just like you, Sarah, like you do more than what you think you do. You touch more people than you think you know. We always underestimate the impact that we have on this world.
I love that. Well, you mentioned your previous student who's working at the VA. You also have been working more recently with the Hines VA. Why is veterans care important to you?
I've been working at within the VA system for over 20 years. I started at the Atlanta VA Medical Center. And so actually one of my very first patients when I was an intern was a guy who landed on Omaha Beach. And he
Oh,
was
wow.
only 5 foot. I remember thinking like, gosh, this guy's so small. He was like 90 pounds, 5 foot. How could he have survived Omaha Beach that day, in the invasion of Normandy? And this was so I was an intern on the 50th anniversary of the invasion of Normandy. Now we're on the 80th anniversary. So just talking with him and learning about his experiences, it just really made me think that these guys are just heroes, and it's just such a privilege to be their physician. And I still think that way. I love working at the VA. It's really a great place.
How do health disparities, which you've talked a lot about, play a role in veteran patient lives?
I think the VA is someplace where we really do break down health disparities. These guys come in and we're able to get them access to multidisciplinary care within their primary care team. So they have access to a social worker, they have access to a pharmacist. Their medications are very low cost. Their copays are very, very low, even for high cost medications. And everyone gets treated that way. And so, like, actually, if you look at disparities within the VA system, it's very, very small compared to what you see with, private insurance and Medicare. So, yeah, I think the VA shows that you can eliminate disparities if you provide better health coverage.
My own father was a veteran, and for a long time, he didn't take advantage of the VA. And then once he started going, you couldn't keep him out of there. He was down there 5 times a week. He loved going down. they were
Aw.
they were probably a little bit sick of seeing him, but he loved heading down there. How did you become involved with the National Kidney Foundation?
So I applied for a research grant. I did get a young investigator grant. And at the time, I was pregnant with my first child. And then I got pregnant right after, like within a year. So I had two kids within, a year apart. And so
Wow.
I didn't get a ton done with that research grant. And so I saw the general counsel of National Kidney Foundation at some meeting, and I went up to him and I actually apologized. I said, "You guys gave me this grant, and I didn't publish a lot of papers with the data, and I told him, my story and everything." And I said to him, "If there's anything I can ever do for the National Kidney Foundation, please reach out. I want to try to pay back for what you guys did for me." And so he did. He actually got me involved with KDOKI. So that was in 2009. I've been involved with KDOKI now since 2009, and then I ended up becoming the president in 2019 and 2020 during the pandemic, unfortunately. And then I've been on the National Kidney Foundation of Illinois board of directors as well.
Why is that volunteer work so important to you in addition to all the work you're already doing for kidney patients?
Working for the foundation gives you a completely different perspective of kidney disease and also your patients. Like, for example, the Living Donor Protection Act. If you weren't involved with the foundation, you wouldn't even understand, like, necessarily how that affects what you do, right, at
Mhm.
the clinical, or how that would affect a patient. But I think all of that type of issue, or the fact like the National Kidney Foundation actually, pushed the U.S. Preventive Task Force to re-examine all their data, because right now, like, we have no recommendations at all for kidney disease testing in high-risk populations, which seems absurd, right? And it was the National Kidney Foundation who said, you need to relook at this, and sent them a really long letter and saying, you need to relook at this. And so they are, right? They are re-examining the data, and we're waiting for those results. So just like we said before, like, it's one person who, or one or two people who really like say, we need to do this, we need to ask about this, we need to change this. And so if you're not involved with the foundation or other groups, you miss that action that's going on. Now, another thing I think a lot of people don't know is that the National Kidney Foundation reached out to the FDA and said, drugs are not being developed because you're requiring these really difficult endpoints. Kidney failure is a rare event.
Mhm.
If all clinical trials have to be assessed by whether or not they prevent kidney failure, we will never have drugs. And so they, went and together had this big conference, and some really smart people examined, huge cohorts of data to look at surrogate markers of kidney disease and how drugs affect these surrogate markers. And so then that led to the FDA saying, okay, we will approve a change in the urine protein excretion as an endpoint for clinical trials. And then that just opened a Pandora's box. And so that's why now you're seeing like 3 different new drugs for this glomerular disease, and complement inhibitors, and just a panacea of new medications to treat kidney disease. And that's because of the work of the National Kidney Foundation. So this behind the doors work, that's happening in the National Kidney Foundation, it is changing the face of kidney disease.
It makes me very proud to work for this organization to hear you say that. So, between teaching, caring for patients, researching, volunteering, and raising children, when do you sleep?
Oh, I definitely sleep. I love my sleep.
What keeps you motivated to do all of those things?
There are times when I lose my motivation, right? Like, kidney disease can be really, really tough on caretakers, on patients, and the people caring for them, right? It's a really tough disease. It doesn't go away easily. And I just think of my mom, like, what would my mom want, And also, I allow myself to feel sorry for myself for 24 hours. So if something goes wrong, my manuscript doesn't get accepted, I allow myself to feel bad for myself for 24 hours, and then I have to stop. And I would give that advice to other people, like, have a pity party, but then the pity party has to end and you have to keep going.
Feel your feelings and then start over or move on the next day.
Move on. Yep.
What do you hope your lasting legacy will be?
I really hope that my lasting legacy will be that I inspired other people to be heroes. I don't think that I'm the hero, but I've really spent a lot of my energy trying to get other people to believe in themselves and believe in the change that they can make.
I love that. I absolutely love that. Well, thank you so much, Dr. Kramer, for being on the podcast. We really appreciate it. I've enjoyed our conversation and hearing all about all the wonderful things you're doing and ways you're inspiring people.
Well, thanks, Sarah. It's really great talking to you.
Thank you. You can find Dr. Holly Maddox Kramer at Loyola, the Heinz VA, or many of NKFI's events and programs. To learn more about the importance of nutrition and prevention of chronic kidney disease, visit our website at nkfi.org. Much like Dr. Kramer, prevention is a key part of our mission at NKFI. That's why at the end of each episode, we offer a health or nutrition tip.
Here's today's nutrition tip about fluid and hydration. Drinking enough water every day has a big impact on your health. It can prevent dehydration, help with maintaining your body temperature, allow for regular bowel movements, and help to prevent kidney stones. Water and proper hydration are necessary to lubricate and cushion your joints, protect your spinal cord and other sensitive body tissues, and help to rid your body of waste through urine, perspiration, and bowel movements. A common question is, how much water should I drink in a day? That answer varies by person and health condition and is best answered by your healthcare provider. But in general, you want to make sure you are drinking enough water to produce urine that is a light color. Darker urine may indicate that you are not drinking enough. While water is the drink of choice, other beverages such as tea, coffee, and milk can also keep you hydrated. Don't forget that some of the foods we eat have a higher water content and can help you meet your fluid needs. These foods include soup, fruits, and vegetables. Wondering how you can drink more water in a day? Try a few of these tips. Carry a water bottle with you and refill it throughout the day. Freeze water in a freezer-safe water bottle. Take one with you and then it'll thaw and you have water all day long. Choose water over sugary drinks. Opt for water when you're eating out. Serve water during meals and add a wedge of lime or lemon to your water to enhance the flavor of water and help you drink more water than you're used to. With today's nutrition tip, I'm Melissa Prest, a registered dietitian nutritionist